I went down the tattoo rabbit hole, and you might wonder why. I'm a plastic surgeon. Why do I care? The reason is that many of my breast reconstructive patients opt for a traditional tattoo as part of their reconstructive journeys, and I love science. So let's discuss this article that I've seen floating all over social media. We're going to break it into two videos. So first, let's talk about how the study was designed. There were two parts to this study. The first study was a twin control study. So they identified twin pairs in which at least one twin had developed bladder cancer, skin cancer, or lymphoma. The second part of the study was a cohort study where they just identified a lot of twins. And the rates of cancer were so low in that part of the study that we're not even going to address them. But let's talk about the twin control study. We're going to analyze this table together. So you can see there's three different columns. There's lymphoma, skin cancer, and bladder cancer. And then under each is case and control. So case means the twin that developed that cancer, and then the control is their twin. Now, why aren't the numbers the same? That just means that they were missing information about one of the twins, but we can still analyze the data. I have it pulled in front of me because I want to get the numbers right. So let's start with lymphoma. If we look at lymphoma in these twins, so there were 316 people to start with. In these twins, 32 people developed a lymphoma, and then there were 34 controls. And then if you look at those 32 people who developed the lymphoma, there were 10 people who had a tattoo, and of the 34 controls, there were 11 who had a tattoo, which ends up being 31% and 32%, so basically the same. And that's why the study concluded that there was not an increased risk of overall tattoos for lymphoma development. Let's talk about skin cancer. So if you look at skin cancer, there were 119 people who developed skin cancer and 104 controls. Of those 119 people who developed skin cancer, there were 30 people with tattoos. Of the 104 controls, 25 had tattoos. And this was 25% and 24%. Now, since these numbers were slightly bigger than the lymphoma, this actually did reach statistical significance. Now, when you're looking at statistical significance, so yes, it did reach statistical significance, but these were very small numbers that we were looking at, so the clinical relevance is a little questionable. What we're going to talk about in the next study is the impact of large tattoos and the other confounding factors in the study, so stay tuned.